Hi, everyone. My name is Emma Mock, and I'm a patient advocate with the Cholangiocarcinoma Foundation. Thank you for joining today's educational webinar. I'm pleased to introduce Kate DeBartolo, Senior Director of the Conversation Project, Institute for Healthcare Improvement. Ms. DeBartolo oversees the Conversation Project, IHI's public engagement initiative to help people share their wishes for care through the end of life. In addition to leading the Conversation Project team in operations, Ms. DeBartolo manages and cultivates relationships with national and state level organizations that help engage the general public in advanced care planning. Since starting in July 2007, she has been involved in the 5 Million Lives campaign, Improvement Map, Project Joints, and many of IHI's other large-scale initiatives. Prior to joining IHI, Ms. DeBartolo worked as a grant analyst at the California Endowment. She is a graduate of Wellesley College and currently lives in the Washington, D.C. area with her husband and son. Please feel free to write your questions in the chat or the Q&A box, and I will read them aloud after her presentation. Over to you, Kate.
Thank you so much for having me, and hello everyone. It's really nice to be with you. As mentioned, I'm in DC. I've got a little bit of the allergy back to school cold situation going on here, so apologize for the husky voice, but nice to be with you. As mentioned, I'm the Senior Director of the Conversation Project, here to chat with you a little bit today about this initiative to help people have conversations about the kind of care they want now and through the end of life. But before diving into all of that, I thought I would share a little bit about myself and find out a little bit more about you. So these are some photos from my wedding, which was now about 10 years ago. And I joke that wedding photographers are so expensive. I like to get as much use out of the photos as I possibly can. But I've got a picture with my husband here. He and I have had these conversations, and his father died very unexpectedly at age 41 playing basketball. And so we've had a lot of conversations about what would happen in our lives if something unexpected occurred to one of us. I've got a picture with two of my sisters in the upper right-hand corner. One of them's about 20 years younger than I am. My dad has another family and even a third marriage now with a variety of step siblings and all sorts of blended family dynamics to think about with him. And in the bottom right-hand corner is just my mom's side of the family. She's one of 7. And we had really amazing experience actually with at the end of life for both of my grandparents of how well those 7 siblings were able to be on the same page and really be supportive of each other through a hard time. And so this topic has been very important to me in my life in many different ways as a caregiver. And I would love to hear a little bit more from you in the chat if you have a moment of your preferred name and maybe who are the people in your life that either you're accountable to or that you may support. And I'll just wait one moment and keep an eye out for the chat. If you want to share where you're calling in from too, that's always fun for me to see. As I mentioned, I'm in Washington, D.C., and it is a very rainy day here today. While I wait for some of the chats to come in, I'm going to go ahead and share just a little bit more about the Conversation Project. We are a national nonprofit initiative with the goal to help people share their wishes for care now and through the end of life so that those wishes can be better understood and respected. We have no position on the type of care somebody may want to choose. We often joke that we should be the Conversations Project, that this isn't one conversation that you have in your life. It's many conversations and how we can try to help normalize helping people have these conversations. And for us, it's really trying to shift a mindset from focusing on what's the matter with somebody to what matters to them and how we can make a lot of our medical decisions and choices based on what matters most to someone, and how we try to provide some tips and tools to make that easier. And I'm just taking a quick peek at the chat. I see some folks who are caregivers, somebody's patient, people Pacific Northwest, and then Alabama, New Jersey, Massachusetts. Nice to see folks all over the country. Thank you so much for joining us today. And there's two reasons why in our project, we really focus on talking and on conversations. You have maybe heard of advanced care planning or people focusing on documentation or healthcare proxies or wills or materials that you might fill out with an attorney. And I don't want to negate the value of those. I think those are really important. But I don't think that it does us much good to have a document that lives in a filing cabinet that nobody's ever talked about before, or that might be 15 years old. I remember somebody saying, I have something and it's in a safety deposit box, but I've never told my family that I did that. I did it a long time ago. And so for us, we think that talking really matters because we can't plan for everything. We can't talk about every hypothetical scenario that might play out, but we can share what matters with us, with the people who matter most to us. And that when we create that kind of shared plan and we can talk about it, it gives us a foundation that we can base our care choices off of. So we believe that by helping normalize these conversations, it makes it much more likely that somebody's wishes are more likely to be honored. And that when having conversations, listening really matters too. So while we're going to give some suggestions for how to talk about this, especially for those of us who are in caregiver roles, so many times in having these conversations, it's really about trying to offer up some prompts, some open-ended questions, and trying our hardest not to impart what we would want in a particular situation, but really to listening to what somebody else is trying to tell us. And that's when we can have the most profound change on people. And we'll try to offer you a couple of examples on how to do that. We've worked closely with Dr. Atul Gawande, who wrote the book, Being Mortal, if you've read that book or seen the PBS documentary on it. And he has this great quote about how our ultimate goal, after all, is not a good death, but a good life to the very end. And I think this captures so much of what the work of the Conversation Project is, that for us, these conversations are about how we want to live our life through the end in whatever time it is that we have left. And that's a conversation that all of us should be having. Anybody over 18, and we'll talk about this, kind of who should be having these conversations and how it's everybody. And that it's not an emphasis on how does somebody want to die, but how do you want to live your life through the end, and how can we make those choices based on what matters most to us. So we have a website available. All of our resources are free. People can go and check out some of our free conversation guides. And I'll walk through some of them a little bit more, but how to have conversations, how to choose the person who might be your healthcare decision maker, or how to be a healthcare decision maker. If you know you're going to be somebody's proxy, what are some tips that we might have for how to do that? Maybe a guide for how to talk to a healthcare team. What do you do if two clinicians are disagreeing with each other or not listening to what you're trying to say? We also have guides for caregivers of folks living with Alzheimer's or other forms of dementia, parents of seriously ill children. And then we have a workbook for individuals living with serious illness that never mentions end-of-life care. That's something that we created with Ariadne Labs, and it's much more about living with a serious illness. All of these tools are freely available, and they're available in English, Spanish, and Chinese. And we have audio versions of them as well, like a video that could play and you could listen to somebody speaking out the words as well if the written booklet or PDF is not helpful. And then on our website, we have a lot of different blogs and examples of people sharing some of their stories or what matters most to them. And we work with groups all over the country who are trying to help normalize these conversations and bring it to their local community. We talk about trying to reach people where they live, work, pray, and learn, so that these conversations are not only happening in a doctor's office or in a lawyer's office, but there are employers who are helping normalize the fact that many of their employees are caregivers when they go home. And how can we help support family caregivers? How can congregations be supporting members of their faith and understanding pastoral care or denominational lens on some of the questions that people may have? So we're working with lots of groups around the country. But so that's just a little bit of background about us. But today, just wanted to start with diving into our conversation starter guide, because really for anybody who's on the line today, whether it's in a patient role, a caregiver role, a provider role, just a listener, I would encourage us to think about this for ourselves, so that this kind of applies to everybody, to be thinking about what matters most to us and who we could be talking to. And so I want to just kind of walk you through some of the types of questions that we offer in our guide. And a lot of them are meant to be open-ended. We know that over 90% of Americans think this is important to do, and yet they're not always quite sure where to get started. And so that's what we've tried to offer here. So some open-ended questions, and I would love if you have answers to similar questions, would love for you to pop it into the chat here. One of them here is to try finishing this sentence. What matters most to me through the end of my life is, and you can fill in the blank. There's no right or wrong answers about what matters most to somebody. We have seen answers that range from in the hospital with excellent nursing care. There was a woman who told us that one of the most important things she wanted people to know is how much she hated having the sheets tucked in around her feet. And so if she couldn't speak for herself, she needed to be sure that people understood how much she didn't like that feeling. But when we've asked thousands of people what matters most to them, you can see in this kind of word cloud, the larger the word, the more frequently it was mentioned. And very rarely is there a medical term that's listed here. This is, again, getting a bit more to what matters most to people, not what's the matter with them, and not just about medical choices, but about their values and what matters most to them. And we then invite people to think through some questions of, I would call them like a scale question. For example, the second question, what are concerns about medical treatment? Are you concerned that you won't get enough care or that you'll get too much care? No right or wrong answer to that. People feel very differently and may fall on one end of the spectrum or right smack dab in the middle, but it gives you something to start talking about. Oh, wow, I'm really worried that I won't get enough care. And that's something that I want to talk about with my providers, or I want to talk about that with my family. So by providing some of these scale questions, it gives you something to start responding to about the kind of care that's important, the role that you want other people to be playing in that, and gives you some things to talk about. You'll notice that these aren't questions about ventilators or feeding tubes or CPR. It's not about medical treatment choices. It again gets back to values. And then we invite people to think through who you want to have the conversation with. So it might be a spouse or an adult child, but it doesn't only have to be that person. So kind of thinking through who you might want to talk to, where would you feel most comfortable having this conversation, really starting to make a plan. We have this line of that it always seems too soon until it's too late. So starting to get pretty specific about, I'm going to bring this up next Tuesday when I see my sister, we're going for a walk. And even if I'm just going to broach the idea that this is something that I want to talk about, I'm going to start to make a more specific plan. We think it's really important to have this conversation early and often. I was talking with Emma earlier that I'm speaking in this next week to different medical students and a lawyers group and financial planners and nurses and a congregation. So there's all different types of entities that are really trying to help normalize these conversations to make it easier for an individual to do it, and also to make it more normalized so that as society, we don't have as many taboos about having these conversations. We're seeing a lot more young people, college students in particular, who are saying, hey, I'm 18 or I've moved out of the house, I've switched states. I need to make sure I have a healthcare decision maker because my parent isn't an automatic choice anymore after I'm 18. So that's a good point to have it. Maybe each decade before a medical crisis, major life events. So I had this conversation with my husband when I got married. We had it again when we had our child. People may do it different life events. So a divorce or a second marriage, maybe when somebody's eligible for Medicare or a death in the family. My father did it when he went on a motorcycle trip across country 2 years ago, because it was a different conversation then. We'd had a general conversation, but this was then like, okay, if you were to be in an accident during this trip, what should we know about what matters most to you? And then particularly upon being diagnosed with a serious illness, that may help put the conversation into less of a hypothetical mode and a little bit more geared towards what we know about a particular illness. And then we offer some icebreakers for how to start this conversation. A big one can be, I need your help with something, or I was thinking about what happened to so-and-so in our family, or a favorite character from a TV show. You know, the TV show This Is Us just had their whole series finale and had an amazing series of family conversations. And it made me realize, I'm not sure I understand what you would want in this situation, or I haven't told you what I would want. I think all of you have the best excuse of anybody from having attended this session of, I was joining this webinar and I heard about this project. It made me think there's a couple of things we could talk about. Could we talk about that later? You're going to know best how your people are going to respond, what the proper tone is. I've seen everything from a woman in Akron, Ohio, who used to make the desserts for her family at Thanksgiving, who held it all hostage and said, no pumpkin pie till you tell me how you want to die, and made everybody go around the table and talk about their wishes. And that would be wildly inappropriate for another family, where it might be much more formal or more quiet, or more appropriate to send an email ahead of time saying, I'd love to talk to you about this, or even to just say, I'm going to send this to you via email. I don't want to talk about it that much in person, but I really want to be sure you know what my wishes are. So you can think about what feels most comfortable for you and for your person, but we've offered some icebreakers there. And then, as I mentioned, we have some other resources on kind of how to choose a healthcare proxy, how to pick the person who might speak for you, how it doesn't always have to be a spouse or an adult child, and some suggestions on what to consider otherwise. I'm going to pause for one moment before going into tips, just to see, Emma, if you've gotten any other questions, or if people want to pause for a moment and type in any questions before I go on with some additional tips.
I haven't received any yet.
Okay. I like James sharing a what matters statement of enjoying seeing where my kids end up in the journeys they are on.
James is a patient and he just ran the Chicago Marathon as well.
Not too shabby.
Yes.
Here I was this weekend in New York City, and I had to walk 17 blocks with a toddler and no stroller. And I thought that was heroic. The book I mentioned at the beginning is called Being Mortal. I'll type it into the chat if I can here. By Dr. Atul Gawande.
So Jeffrey said, hi, you mentioned a book at the beginning. Could you please tell us the title?
So I've just typed in the answer for that, of Being Mortal.
Oh, thank you.
So I'm going to share a couple more tips, and then would love, as you're hearing them, sometimes if we were in person, we would be asking people to think about their wishes, or to share something that's come to mind for them, or that feels really important for them that they would want to share, or that they've seen within their family or friends, or again, sometimes it's a favorite character from a book or a movie that can inspire somebody to think about what they want. I'm going to share an example from Eeyore in Winnie the Pooh in a little bit, but I'll share with you some tips, and then would welcome your questions at the end, or your feedback that you might have. So the first one is this idea of thinking about the role that you want to play, and no matter what that role is, making sure it's known. So an example here, I've got a picture of Katie Butler. She's an author who wrote a blog piece. She's written some books, and she wrote a blog piece for us that was very, very prescriptive to her future medical advocate of, if you're reading this, because I can't make medical decisions due to dementia, this is exactly what I want you to do. I want you to follow my very, very explicit instructions here. And that was based on her own experience with her father and some things that were very important to her. She felt very strongly about the role she wanted to play making those choices. On the other hand, I met a woman in Nevada. I was in Las Vegas, and she was going through our guide, and she was like, you know what? I don't really care about any of these questions. Honestly, I want my kids to decide what feels best to them in the moment. It's so hard to think about what the scenario would be. I just want my son and daughter to decide. But she had not told them that. And that right there is the conversation she could have so that they don't feel like, wow, we've never talked about this with mom. Now we're in a decision, a point where we have to make these choices. And I wish we had talked to her. If all she says is, this is important to me, I want you two to be on the same page and to do what feels best to you, that still makes a really big difference. And I think that's one of the things that has drawn me so much to this work, is not only about the experience of the person at the center, whose health and wellness and potential future death we are describing and how we want that to be on the terms that they want, but also the implications on the grief for survivors afterwards, and how complex or how complicated the grief can be, especially if siblings maybe aren't getting along, or people are left wondering, I don't know, I had to make these choices, and I wish I could have my dad in my ear telling me what to do. That oftentimes the depression rates are lower for people 6 months after the loss of someone, if they've had these conversations, because the grief is not as complex, if they're not second guessing a lot of things. So another thing is to think about the type of care and to really give current answers. So we will hear from people inevitably, not always in a scenario like this where we're in a kind of condition specific call, but people will say, well, I don't know if I'm going to have a type of cancer, or if I'm going to get hit by a bus, or I don't know what's going to happen. How can I possibly answer this question when there's so many hypothetical scenarios? And that's actually the point. You can't answer every hypothetical medical scenario. So what would you want right now if you couldn't speak for yourself and somebody else had to make choices? When I mentioned that my husband and I did this when we were first married, and he went and filled out his little workbook and he answered every single question as if he were 85 years old with Alzheimer's in a nursing home. And as I mentioned, his father died at age 41 playing basketball. And I was like, we have time to get to the 85-year-old scenario. I need to know what you would want right now if something unexpected occurred in our life. What's important for me to know about you right now? An example would be a friend of mine who has 2 teenage daughters, who has it down to one sentence to her husband, that as long as I can emotionally and intellectually parent our children, I'm in. If there's an accident that happens, or you have to make choices about my care, but the prognosis is that I would be able to communicate with them and help them with their day and deal with what's going on in their social life, I would want you to do as many extreme measures as possible. And I'm willing to forego, a lot of physical limitations in order to be able to do that. But if I'm not going to be able to communicate with them or understand what's going on socially for them, then I don't need you to take such extreme measures. In Atul Gawande's book, he talks about a colleague whose father says, if I can eat chocolate ice cream and watch football, I want you to make a lot of choices that would allow me to do that. But if my quality of life would not allow me to do that, I don't need you to take extreme measures. So keeping the current body in mind, I think, is really helpful. We often will hear from people the idea of being at home is really important. And I just want to unpack that one a little bit, because folks will say, my mother really wanted to be at home and it wasn't medically feasible. Her care got so complex, we couldn't do it. Or we lived in a 5th floor walk-up in New York City, or financially we couldn't pull that off. And I feel a lot of guilt that the one thing she wanted was to be at home and we couldn't do it. And I think it's really important to understand, what is it about home that is most important to someone? So an example for my grandmother was having her cat with her. if she could have Pele by her side, she was willing to go anywhere. And she did need to be admitted into more of a memory unit that allowed her to have her cat with her. That was home. For other people, it's feeling like somebody will visit, or that they can have access to home cooked food, or that they have a private room, or that they can put artwork up on the wall. But understanding what is it about home can be really helpful. And then to be careful about people who say, well, if I ever get like that, pull the plug, or give me the whole enchilada. I would say those are the two ends of the spectrum where people think they are telling you what they want. And in many ways they are, but maybe asking a little bit more about what that means. It sounds like you would want those kind of aggressive treatment options. You want to try every trial that's out there. You want to full court ICU, give everything for the last drop, versus aggressive comfort measures. And if people are kind of doing that, if I ever get like that, and kind of passing off a comment, really asking them to dig in a little bit more. Can you tell me more about what it is that's concerning to you about that? Or can we talk about that a little bit more? I remember a gentleman out in California who was like, oh yeah, my wife and I have talked about this. You know, both of my parents had Alzheimer's, and I just told her, if it ever looks like that for me, we're just going to have a big party on the beach, and then I'm going to swim to China. And if I don't make it, oh well. And he's laughing. And his wife was rolling her eyes, being like, he always talks about this party on the beach, but that's it. He won't ever talk about it more than that. And that became their entry point for understanding what it was that he was afraid about and what he wanted to discuss more. And I guess what I want to name, having had these conversations out in the field now for almost 10 years, working with thousands of individuals and family constructs and types, is that while the conversations can certainly be sad, and addressing mortality can certainly be humbling and sad, it is many times strengthening to a relationship. It's not always tears of sadness. It can be funny stories and laughing, and a chance to show respect and honor, and a chance to clarify the willingness to help support someone. And so I think sometimes we're afraid to bring up these conversations because we don't want to upset somebody else. And yet it can be a really loving conversation. Doesn't always have to be super serious. So I just want to give permission for that it can go very well. And people are often very relieved to have had these conversations. Two sets of or some messaging that works really well that we've worked on with some groups around the country. It's just this idea that conversations clarify, and that there are some people who are like, oh, we don't have to talk about that. You know what I want, or we don't have to go there. But especially when there's an illness where we have lost so much control over what's going on in our life, to gain some conditional control back and to be able to talk about what matters and to have a say in the care that we want can really make a difference, and conversations can clarify either with clinicians or within family members. And to demand that shared decision making, that we can have a say in our care, that our providers want us to have a say in our care. So many providers will say, like Atul Gawande was talking about, somebody would say, well, I don't know, doc, what would you do if this was your mother? He's like, well, I don't know. What does your mother like to do? Is it important to your mom that she still be able to ballroom dance? Is that something that's really important to her? Kind of paying attention to how you have a say in your care, and how many clinicians would rather have a family come in without the legal documents in hand, but everybody being on the same page, and not having somebody swooping in saying, oh no, mom told me something different. That's what can really make a big difference. And this message of we'll figure it out together can go a really long way of helping somebody not feel like they are by themselves in it. I want to go back to one thing. I forgot this one slide. I zipped past this one. This is the idea of the role that others may play. When choosing a healthcare proxy, asking if the person can and will honor what your wishes are. So there was a woman I met in Hawaii who was trying to choose her healthcare proxy, and she thought her husband was going to be the proxy. And after she told him what he wanted, he was like, I can't do it. I will sit by your side for 20 years in a vegetative state. Like, I don't make me have to make some of these decisions. She said, okay. And she went to her oldest child, who was like, I got it, Mom. You don't want any intervention ever. I'll never let them hook you up to a machine. Like, you're ready to go now. And she was like, whoa, also not what I said. Her middle child cried the entire time and couldn't have the conversation. And she went to her youngest child, the fourth person, who really listened to what she wanted. It was like a Goldilocks situation of like, here's the person who's going to focus on what I want. And that's who she chose. I saw a question in the chat, and I just want to pull it up right now. As a single person, although with many caring friends, I'm still unsure how to find individuals for such a role or to hire. And so I wanted to name, we have a blog post that I can try to find specifically for solo agers or for people of what are tips in terms of either identifying a healthcare proxy or choosing somebody to play this role. And it might be that there's a caring friend or a cousin, or we've seen a congregation that has sometimes paired different congregants who are in the same situation to say, we've got two solo agers they would like to put together. Can you both be each other's proxy? And in some states, you're able to hire somebody to play that role. There's a couple of different state rules and regulations, so that could be worth reaching out. I think, well, it's not always an aging problem. A local area agency on aging might be able to help you answer the question regionally of whether that's a hireable role within your state or not. But we can also get you that blog post. I would say to tell more than one person. There's a woman I met in Florida who said that she and her husband had had this conversation. She knew all of the things that he wanted. She felt very well prepared to be his proxy, but she realized that she was his second wife and he had two adult children and they had no idea that she was the proxy. She was like, it is going to cause World War III if something happens to him and he hasn't told them that I'm the one making the medical choices, and how it can make all the difference in the world for him to just say, hey kids, heads up, we've been working on our affairs and Barbara's in charge of medical choices. He doesn't have to get into all of the medical decisions. He can just have alerted everybody to here's the plan. And that's how it played out in my mom's family. As I mentioned, she was one of 7. My mom was the healthcare decision maker. She'd had the more in-depth conversations about what both of her parents wanted, but the other 6 children knew that. And one was the financial person, and one did housing, and one did, they all had different roles. But it was helpful that we talk about the seagull syndrome of somebody, swooping in from out of state to change the plan at the last minute and kind of dump on the plan and fly back out. That's what we're trying to avoid by encouraging conversations, making sure people are aware. That's where sending an email, putting everybody on the same message so something can be referenced can make a big difference. To beware of family or caregiver bullying. There's, and bullying might be a big term here, but I remember being at an event and at lunch, a woman got up in front of a crowd of easily 200 in tears. And she said, I owe my father a huge apology because last night he started to get really sick. And she named off a lot of health issues he was having, and he was really declining last night and he wouldn't go to the hospital. And my siblings and I were laying it on so thick, showing up at the house, calling, texting, making him feel so bad about not going to the hospital. And I realize now he's trying to tell us something about what matters to him and about how he wants this to go, and we are not listening. And so I've already texted my siblings that we need a new family meeting this evening and we need to focus on him. And just that idea of kind of like, how do you keep the person at the center of what they want and not what everybody else would want in this situation, can be really important. And then I mentioned Eeyore, but there are some folks where even with all these guides or all these tips, it's still going to be hard to have this conversation. It's hard if you're not feeling well. It's hard to emotionally go there. And sometimes it can almost be easier to ask yes/no questions of, this is really important to me. I want to be sure that I understand what matters most to you in this situation. Is it correct to assume that I should be your healthcare proxy? Yes, no. There was a woman who talked about how her husband was basically Eeyore with this and didn't want to talk about it and was kind of mopey. And so she said, here's what I think you would want in a future situation if you couldn't speak for yourself. She laid it all out. Is that right? Yes, no. And he was able to say, yeah, but here's one thing that's a little bit off. And she felt so much relief from being able to have talked about it that way. It didn't have to be a big sit down formal conversation, but there's a way of inviting people to share what their wishes are by proposing what you think it would be and asking them to reply yes or no. I see there's a question coming in from Facebook. Would you recommend bringing in one of your printed tools outlining my wishes to a doctor if my providers are having different suggestions than what I want? Absolutely. We have a guide on how to talk to your healthcare team, especially if it feels like they're not listening to what you want. And it has some sample scripts or text that you can use. And I think that being able to articulate back what you're hearing, and I'm trying to think of what an example might be, but perhaps they are suggesting more or less intervention than what is appealing to you, or more or less pain management, or you want more support. Being able to talk about what matters most to me, or what feels safe to me, or what success looks like to me, what my wishes are, and to even say that back of, I don't think you're hearing what I'm saying. That sounds like a lovely plan, but it's not what I am asking for with my care, and helping them be sure. I think a lot of clinicians, training is getting better, but for a long time, science and technology were not this advanced. It's almost like we're in this weird spot of medicine and technology where we have so many options available, and we haven't all been very well trained in how to have these conversations, how many options there are. I think that being able to kind of push back on clinicians for that can be really helpful. And I do think that palliative care departments or palliative care nurses, it's really an extra layer of support that can help be champions, or social workers within a setting, to just say, like, I feel like my wishes are not being honored, or here's something that's really important to me. There are other people that you can escalate to within the healthcare system as well. But it's a great point also of having a healthcare proxy. Doesn't only have to be when you can't speak for yourself. Sometimes it can be helpful to have somebody who's a little bit of a bulldog, who's willing to be there with you in an appointment to say, like, you're not listening to my sister. She just said she wanted XYZ. They can be the person who speaks up a little bit more. So if that would be helpful in terms of having an additional advocate, our guide for how to talk to a healthcare team may be helpful for them as well. So I just want to share, I want to wrap up so we have time for more questions, but wanted to share this email we received from somebody. In her case, she was talking about her grandparents and how they kind of lived alone in another state. There was nobody to take care of them. She had tried suggesting, assisted living or having a healthcare proxy in the past, and it wasn't working. And she was talking about how she looked at our guides before she went to go visit them. And this idea of, I changed my usual approach and I started asking questions instead of telling them how worried I was. And that to me was a huge part of the listening. I'm asking questions. I want to hear what matters most to you. And it started a two-way conversation. And now they are open to me being the healthcare proxy. They've agreed to move. We kind of have a plan going forward. And I think that worry and concern is a super valid feeling. And it's overarching so much, especially with such a tough diagnosis, and to be careful about what our own wishes are, especially in the caregiver role, and how we can focus on asking questions can really go a long way. So my hope in terms of leaving in action would be that maybe completing the conversation starter guide, picking your person or starting the conversation. For those of you who are the caregivers on the line, this is really important to do yourself and to normalize and to have be the norm within your entire kind of extended world. So I think this idea of bringing the what matters to me concept back, I say it's organization or community or your sphere of influence, your friends, your book club, you're normalizing this with others in your world, I think can go a long way. And I just want to leave with this letter that was written by a physician who attended one of our early meetings. We were talking about this. She pulled out a notebook. You can see her handwriting here, but it's a letter that she wrote to her daughters while we were talking. And she said, if you're faced with a decision that you're not ready for, it's okay. I'll try to let you know what I would want for various circumstances. But if you've come to something we haven't anticipated, it's okay. And if you come to a decision point and what you decide results in my death, it's okay. You don't need to worry that you've caused my death. You haven't. I will die because of my illness or my body failing or whatever. You don't need to feel responsible. Forgiveness is not required. But if you feel bad, responsible, guilty, first of all, don't. And second of all, you are loved and forgiven. If you're faced with a snap decision, don't panic. Choose comfort, choose home, choose less intervention, choose to be together at my side, holding my hand, singing, laughing, loving, celebrating, and carrying on. I will keep loving you and watching you and being proud of you. I think of what a gift this is for her daughters to have in her handwriting, something saying what she wants, and it's okay. And you don't have to worry that your choices have caused my death. It's you didn't cause this, and what a load that is lifted for them. And so I just love this and wanted to offer it and share it here. I know we talk conversations as if they're all verbal, but many times it's the expression of words that could be written that might be the conversation that somebody has that can go a long way towards helping wishes be known and honored, and to helping somebody if they're having to make choices. So there's ways of just staying in touch with us. If you are interested, we're on social media. There's groups that are doing things. And then I also have my email here if people have questions, but I thought I would open it up now so we could have more conversations, see if people have questions.
That was really powerful. Thank you, Kate. I haven't seen any other questions come in. So in the meantime, I will just throw out there that next week we have a Canadian support group on Wednesday. We have our caregiver support group on Thursday and a Spanish patient and caregiver support group on Friday. And I will put the calendar link in the chat. So just keep an eye for future webinars and support groups. And we're also starting the turkey trot. So just continue to raise awareness.
I'm going to go out of presentation mode for one moment so I can get a
Okay.
couple of the links to put in the chat for people that we had talked about.
Awesome. Yes, I wrote down Joanne's name for the blog post. If you can't find it this second, feel free to email it over to me and I can share it with the participants.
So that's kind of our solo ager piece. And then I'm going to put a link to where you can get all of the guides, because this would also have where you can get like, how do you be a healthcare proxy, or how to talk to the healthcare team, you know, what do I do when they're not doing what I wish for, which is a real drag. I don't wish that upon anybody.
We just have a thank you. This has been very helpful for him and his wife.
I'm glad to hear that.
So if you have any questions, feel free to email us at advocacy@curecca.org or Kate's information on the screen. Fred said, thanks so much. The last slide spoke volumes to me.
You know what? I'm going to pull that up too, because I think we have it on our website, and I could try to make it shareable for people. It's a little bit more in video format, but
Thank you. So I hope you all have a good evening, and I hope you have something fun planned for the weekend, and we will see you next week. Thanks, Kate.
thank you so much for having me.
Of course.